My name's Thomas Couric. My background's engineering physics, biomedical engineering, economics, entrepreneurship, and executive management. I used to jog 5 times a week on the trails of Reston, and I was bit by a tick. I had very strange medical experiences from about 2012 to 2016. The last 2 years of that period, I was in the hospital many times. I saw over 100 doctors in 1 year. I knew that I was failing quickly, and I had known that it was an infection. I just didn't know what it was. So I came to Jemsek Specialty Clinic in order to get a complex infection diagnosed. Dr. Jemsek was one of 3 doctors in all of these years. In 4 years, I would say Jemsek is one of 3 doctors who even tried to apply their critical thinking in order to diagnose a very complicated case. I had an immunologist and a general practitioner that spent a lot of time. The other doctors wouldn't even spend any time. In fact, some of them tried to get me out of their clinics by using various methods, saying there's nothing more they could do for me, refusing to give me tests that I was requesting. But Dr. Jemsek did everything that I asked of him and more. And he actually spent time trying to diagnose my case. Prior to Jemsek Specialty Clinic, the doctors didn't do much of anything for me. They offered me psychiatric drugs and neurological drugs, which wouldn't do anything for me. I never took them. Occasionally they would give me antibiotics and it would help me for a limited period of time. When I came to Jemsek, we started antibiotics immediately, and also a regimen of nutraceuticals that would boost your immunity. This combination helped me a lot. I received the IV treatment about 6 months after I came here. Before then, I was doing the oral antibiotics. And so we continued those antibiotics for a while, and eventually we started scaling them back because I was improving. And the combination of nutraceuticals, immune-enhancing drugs, immunity-enhancing drugs, and the antibiotics, I recovered most of my normal functioning. I would say when I came into Jemsek Clinic, I was at about 5%, and people who knew me said that they didn't think I had long to live. My skin was gray. I was sleeping probably 14 to 16 hours a day. I couldn't even get up to get a glass of water without clinging to the walls. And there were a lot of other awful things that were going on in hospital visits that I won't share here. But Jemsek's protocol mitigated all of that, and over time corrected those acute experiences that I was having for 4 years that really crippled my life. I was able within 6 months of the treatment to get back to somewhat normal life. I still had a struggle, but I could actually function after then. There were complications along the way because my case was particularly severe. So I had some period of regression in 2018 due to medical error. That's the other thing that they don't really talk about, is that the more you're exposed to what I would call confused diagnostics, you get bounced around between doctors, and you end up in the hospital when you shouldn't be there if you had the right treatment. But you end up in the hospital, you experience greater risks because every time you have to spend in the hospital, you have a risk that you're taking. And a situation like that happened in 2018. When I was hospitalized, they made a mistake, and they infected me with something pretty awful. And I spent 6 months of 2018 suffering, and I almost died from that. Jemsek knows how to handle these things. None of the other doctors really do. There's very few. I mean, there's a few research grade doctors. Like I said before, there were 3 other doctors, and I'm talking about 3 out of over 100, because I had 100 doctors on my insurance report in 2015. Over 100 doctors. That's just 1 year. So I've probably seen well over 100 at this point. And the other doctor that really tried to help me was also like Jemsek. He was a guy that was meant for medicine. He was an immunologist. His wife was a genetic researcher. And he had a true interest in figuring out what was wrong with me, because my case was so abnormal. If you're lucky enough to find one of these doctors who really care and have a true aptitude for the practice of medicine, then they might help you, but most won't. I think that's what sets guys like Jemsek and Oral Alpan apart from the rest. You need a research grade doctor to treat this disease. One thing that set me apart from a lot of Lyme patients that I have encountered is that I'm very faithful. And so a lot of the doctors who would have injured me, they wouldn't have helped me because they had no clue what was going on. And we're talking about, I have a background in biomedical engineering. I've done medical research. So a lot of the doctors that I'm encountering, I'm even better, I'm even more apt than they are to figure out what's going on. I don't have the authority to make my own prescriptions. It's the problem. So if it was this hard for me, when I can speak the doctor's language, imagine how hard it is for a person with no medical background. I can speak their language. I'm telling them, I'm reading the report. I'm like, look, you've ruled out, there's only 3 things that cause this condition that you've pulled off of the biopsy, right? Autoimmune, cancer, and infection. We did all the autoimmunity tests you could imagine. You've ruled out any autoimmune cause. You know I don't have cancer. We've done tests as well for that. So what's left? It's an infection. And then couple that with the information that I had in terms of whenever they would haphazardly give me some antibiotics, I would improve. So what do you think it was? I didn't know it was Lyme at that point. The Western blot test only catches 50% of the strains of Lyme, of the primary bacteria for Lyme, which means that inherently half of the times it will be wrong. They gave me the Lyme test and they kept on saying, well, you know, you don't have Lyme because we've tested you many times. They never will inform you how inaccurate the test is. They wouldn't inform you that there's a more accurate test that they could send away for. Jemsek sent away for that right away, for me. So if I have all this medical knowledge and I could speak to the doctors as I did, imagine how hard it is for someone without that knowledge. So my challenge to Lyme patients is, first of all, don't let them tell you that you're crazy. Do your own homework. Even if you don't have medical knowledge, talk to people in your life that, like me, who might. They might be able to help you read some journals and get you information that you need. If your doctors are giving you tests that you don't understand, they might be able to interpret those for you, or to even see if there's other tests the doctors aren't thinking about. Try to access somebody with medical knowledge in your life to guide you along this process, because it is a very complex disease. And you need someone like that advocating for you. Even when you're seeing Jemsek, you're going to need other people helping you who have medical knowledge. The other thing is, for me, my faith got me through a lot of this. because they want to, almost every doctor I encountered wanted to pummel my brain with chemicals that I didn't need. And I can't imagine people feeling anxiety, even if a guy like me, when I'm telling the doctor, no, this is awful and I'm not happy right now, but I'm not anxious. I would tell them I'm not anxious. I'm sleeping as much as I can. There's nothing emotionally wrong with me. I'm very emotionally stable, but they're still trying to pummel my brain with these chemicals for no reason. If you have faith, it will help you, as it helped me, to avoid the emotional instability you might experience during this disease. And also to not rely on those drugs that they're going to try to give you. Jemsek, one of the first things Jemsek did when I came here was he got an MRI and a SPECT scan of my brain, because he wants to make sure that your mind is doing okay. Lyme can get into your brain. In my case, it didn't. And in those cases, I would say you might, or if you have a history of mental illness, you might want to see a psychiatrist and work with a psychiatrist and Jemsek. But one of the things in my experience that boggled my mind was how little respect most doctors I encountered had for the power of my faith, and the reason why I didn't need their chemicals on my brain to help anything. Those can expose you to great risks, and I'm glad that I rejected that in my healing process. I'm very glad I turned down every attempt at a doctor to give me psychotropic and other neurological drugs.